What is scoliosis? Scoliosis is a naturally occurring sideways curvature of the human spine, which is completely normal, but if the curve exceeds 10 degrees, we need to monitor it. This change in the spine occurs right after the growth spurt before puberty. The most commonly seen type of scoliosis is adolescent idiopathic scoliosis, one of the 7 types of scoliosis. The term idiopathic means that we don't know the exact cause of the condition. Most often, scoliosis results in an unevenness in the muscles. For example, imagine the spine as a young child in a chocolate shop. On the left, there are 3 available chocolates, but in the right of the shop, there are 5. The child will go towards the right. This is exactly what happens in the curvature. The spine moves towards the strongest or more muscular side, since that side can support it better. During the diagnosis, the doctor will ask the patient to bend to see if there are any mountainous regions in the back, which indicates the curve, and if there are any rib humps present. The change in the spine occurs during any phase of the growth spurts, most commonly around puberty. Scoliosis is a progressive disorder, which means that the curve will grow with age, but will stabilize when the patient reaches the skeletal maturity period, approximately 18 years for girls and 20 years for boys. Usually, scoliosis leads to a rotation in the spine which causes the rib hump. Scoliosis is a chronic illness, which means that it will last for many years or a lifetime, but it can definitely be treated and maintained. When it comes to treatment, there are 2 categories: conservative and the non-conservative or surgical pathway. The conservative pathway consists of bracing and exercise. The various braces are the Boston brace, Wilmington brace, Milwaukee brace, and the Chenau brace as well. You may want to consult an orthopedician or a physiotherapist to find out which brace best suits you in discussion with an orthotist. The most common exercise is the short method for scoliosis. Additionally, there is side shift method, SEAS approach, Dobomed, yoga, and Pilates for scoliosis, and other methods which can be discussed with a physiotherapist. The exercises are together classified as PSSE, i.e., physiotherapeutic scoliosis specific exercises, that need to be done under guidance of a trained physiotherapist, as the exercise plans would be individualized based on the curve type and goals. The surgical pathway is best advised for patients whose curvature exceeds 50 degrees. The most common surgery is spinal fusion. Additionally, there is VBT, vertebral body tethering, and other techniques as well. Most patients prefer exploring the conservative pathway before jumping to the non-conservative pathway. It is best to consult a healthcare professional who is specialized in spinal deformities to get a better idea on which treatment to opt for. Here are some facts about scoliosis for the viewers watching. Scoliosis happens mostly in girls, but can happen for boys too. There are 2 types of scoliosis curves, S and C shape. If scoliosis is very severe, it can affect lung and organ function. For younger patients, bracing is more effective because their spines are growing and can adapt easily. Scoliosis dates back to 400 BC, when it was researched by Hippocrates. Remember, tough times don't last, but tough people do.